TopMedTalk.
Nick Majerison here. Welcome to TopMedTalk. Time now to listen to the Pocapalooza. What's that? Well, POC, Perioperative Care. And then a palooza is an extravagant event or celebration of some kind. And that's what this was. We celebrated perioperative care and we took the message around the world in the wake of EBPOM Live from London 2020.
So Monty, you've done a lot of chairing of sessions, Mike and Denny, you as well. So I thought that this time around, we're going to turn the tables a little bit and hear more about what's going on with perioperative medicine in your area. Monty, let's start with you from your perspective. Tell us a little bit more about IBPOM, the International Board of Perioperative Medicine, and then maybe give us a more about what's happening with you.
So if I may, Desiree, I'm going to self-indulgently start the journey from the first EBPOM meetings back in the day. So I'd come back from working in the United States of America. I was passionate about the whole sort of concept of perioperative medicine. I started work at University College Hospital. My first research fellow was a young chap called Grocott. and we sort of grew up together doing perioperative research. And then one day we got involved in, when Mike was more senior at that stage, we got involved in lobbying for improved perioperative care. And I'd been in to see the Minister of Health with the now sadly departed David Bennett, one of our mentors, to talk about greater access to perioperative care facilities, in particular tilting off, better care in the immediate post-operative period. So we started lobbying away, and one day a baroness, she was a baroness who should remain nameless, but we've narrowed the field there quite considerably, who was in our House of Lords, took me aside after one lobbying meeting and she said, you should write a document that looks like a government document. And within 6 months, we will think we wrote it. So myself and Mike Grocott and 3 other authors, under the guise of the Improving Surgical Outcomes Group. This is all top secret, by the way, so don't tell anyone. Or ISOG. Because, who couldn't agree with the Improving Surgical Outcomes Group? So we co-authored an article that sort of described the perioperative journey from evaluation and disruption of the typical referral pathway through triage and modification of function, fitness, frailty, nutrition, the whole 9 yards. And that's coming up on 20 years ago, Mike. I can't remember exactly. Can you remember exactly, Mike, how old it is?
2005.
Okay, so I'm exaggerating. 15 years ago. So that means we've got another 5 years until we reach the inflection point. So that was the start of that journey. And then to cut a long story short, evidence-based perioperative medicine, more than 20 years old. We've grown a global community. I was a national clinical lead for enhanced recovery, along with a lot of the wonderful people who you've participated in this and many of our other meetings. I then joined the College Council. I was asked to lead on perioperative medicine, which is when we wrote our first and launched our first document relatively recently. That then baton was handed over to Mike, so things accelerated and got a lot better at that stage. I then drifted off in parallel and ended up as being the co-president with Paul Miles of the International Board of Perioperative Medicine. So I'll let Mike in a moment pick up on the Royal College of Anaesthetists perioperative medicine journey and the transition into the Centre for Perioperative Care. I'll just expand very briefly on the International Board of Perioperative Medicine, a global endeavour. You can find our links and website in the map in the zone. If you go in there, you'll find out a lot of the usual suspects, many of the speakers in this meeting, that there's no membership fee, there's no controlling structure. It's a collaborative group of people who've articulated, very much driven by Joel Simons and David Walker, have articulated a curriculum for perioperative medicine that is plastic and adaptable. And from that, we've seen a number of pre-existing masters that work to that curriculum and new programs and fellowships that map that curriculum. And now we're here at this Pocapalooza.
One thing that I love about this initiative is this curriculum can be used by anybody anywhere in the world. It's not just something that is for, again, the well-resourced.
So yes, the curriculum is not specific to any particular environment or economic circumstance. It's very closely mirrored. It's obviously drawn from a whole host of different areas, but at the college, part of the work that Monty led as perioperative medicine lead was refining our FRCA, so the Fellow of the Royal College of Anaesthetists curriculum, to make explicit the role of perioperative medicine within there. And clearly a number of those of the elements of perioperative medicine were tucked away in there already, but not stated as such. And it was drawn together and a few bits and pieces added. So, for example, the FRCA in the UK clearly meets the criteria that would be within the IPOM curriculum, as do a number of other qualifications internationally. The beauty of IPOM is it sets an international benchmark against which people who haven't got some sort of qualification, they can tick the boxes, make sure they're covering all the relevant areas.
This is not a doctor, a physician thing. Yeah. Okay. Just to be so if we look at the various different things that are available around the world, whether they be the masters at places like Monash, UCL. Now I think there's one coming online in Manchester, and very many others. That they are multidisciplinary, multi-professional. I don't think there are any boundaries apart from some academic qualifications required to take part in them. There's the massive open online course, the MOOC, supported by the World Federation of Society of Anaesthesiologists, UCL, the Royal College of Anaesthetists, of which tens of thousands of people have done it. And that is completely free if you join in the particular EPOC. There is our new certificate for perioperative care that we're launching with our e-learning platform that's going to be very accessible and very affordable and does not undermine those other qualifications, but it's a contribution to it to say, all knowledge should be as close to free as possible. It's the awarding of certificates that cost money. So I'll be quiet now and just say it's not all about the doctors, it's about everyone.
Mike, take us into the world of CPOC. I know this is CPOC Day and we've talked a lot about it so far. But again, as far as what's happening there on the ground, it's a huge initiative that seems to be, really taking off.
It is important to acknowledge it is testament to the vision of the various members of the Council of the Royal College of Anaesthetists over the last few years, and in particular the President's very, very sadly departed JP Ramsau and Liam Brennan, and more recently Ravi Mahajan, who've been very, very supportive of this direction of travel, and also big-hearted and visionary enough to recognise that this is not an anaesthesia game. It's certainly not an exclusive game. And I think that the beauty of CPOC is it does what it says on the tin. The defining features of it are in the name, and it's about perioperative care. And it deliberately is not about perioperative medicine, and it deliberately is not a faculty. So it's not some offshoot of the Royal College of Anaesthetists that allows anaesthetists to get new credentials. It's very much about bringing together a much broader community who have at the centre of their focus improving patient care and very much the pathway vision. So not seeing surgery as an isolated event that happens in an operating theatre, but seeing it as a journey from the very first moment when a patient starts to understand that they might have a condition that requires an operation right through till hopefully they're in a position where they've fully recovered and whatever that condition is behind them. And all the different steps along that route, which clearly embrace a whole wealth of different professional groups and specialties and environments, going from home in the community, primary care, the hospital, all the different hospital specialists, medical and non-medical, and then all the people involved in the rehabilitation and the getting back to normal journey. So hence, perioperative care, not medicine, and it's a centre which brings together all those different multi-professional groups. And that's probably not a bad point to bring Dave in, who can tell you about all the good things they do.
Yeah.
We're able to bring Dave Selwin in.
Hey, David, it's good to see you again. How are you doing?
Excellent. So I've got one for Monty before we start. So what about today calling it a CPOC-apalooza then?
Let's see. Well,
there we go.
We need a new T-shirt.
The T-shirt. Come on. That's why the hashtag's there for you. See, the hashtag is there.
Yeah. I thought that was a nice one.
Good. We hurrah.
That's awesome. Well, Dave, congratulations on the work that you guys have done so far. I know you've gone over this a little bit, and you will dive more into it here in the next 10 minutes or so. But tell us, Mike was giving us the background, but you guys launched this, what was it, a year ago? This past month,
yeah, just over a year ago. We launched it in May 2019, so we're just past our first birthday, and Mike's described it as it's a partnership between patients, public, professional stakeholders, and the key bits, I guess, is to try and provide that structure so we can bring the interested parties together and we can enhance the best practice. It's not about reinventing the wheel. It's about building on the work that's gone on. So Monty described the years and years of toil, and it's just up to some sort of flash in the pan chap like me to say, oh, well, let's now take this and run with it. But those stakeholders around the table, they come from, as Mike was describing, a breadth of different specialties, be that from the College of Surgeons of England, be that from the College of Physicians, be that from the Royal College of Paediatrics and Child Health, be it from the College of General Practitioners, be it from our nursing college as well. So a broad church, if you like, and that reflects that it's not just for one particular specialty. It's actually patient-centered and patient-focused, and it's more about the skills that you bring as opposed to what the badge says your role and your title is. I think I would recognize that we also need to really, the challenge to us is that whilst we've got a board set up, a structure to drive this forward, hosted within the College of Anaesthetists at present, what I would say is that there are a whole host of other stakeholders involved, be those specialist societies, be those different types of workforce who want to be involved in this, and how we harness that excitement, how we harness that enthusiasm to utilise their knowledge and bring that to the table. That's one of the challenges. We can't really have a board that has 200 people sitting around it because we'll never really decide anything, but we do need to ensure that those people feel part of the process.
I've been in these initiatives before where it's a large group and it's multidisciplinary, but a lot of the people that are involved in it are the ones that are doing all the work. And so they find it very difficult to come to the table to represent themselves. What are you doing to facilitate the collaborative nature of your group there, and maybe some of the action items that you guys currently have?
I guess for that year, a lot of it has been about structure and processes, setting up governance and the reporting systems, if you like. We've got 6 work streams that we've kicked off, and they all have laudable aims: improving patient quality care, empowering our patients, supporting our workforce, enhancing technology, influencing government, and then research and innovation. And all of those very laudable, but what we need to do is to get those work streams to deliver. And so, for example, Monty was describing, we're working on some e-learning platforms to develop some resources for the whole multi-professional team. That would be one example. We're working on guidelines, so we're working with the various diabetic groups within the UK to ensure that we actually have a perioperative diabetic pathway that actually is simple enough for us all to use, and then we can embed and deliver. And then there's a huge piece, and a lot of it was on the chat this morning, a huge piece around shared decision making and taking that forward and actually changing that conversation. And then at the same time, a bit like Monty was describing, we have to challenge government to say, look, this is something that needs to happen. How can you make this happen? Because at the moment, perioperative care in the UK doesn't really have the profile that I think it needs. Now, I suspect that COVID has raised it up the agenda because it potentially has a number of opportunities that it could deliver or help with. But, really, we need to get all of our politicians to be singing about this and describing this so we can get it truly embedded across our workforce.
Mike and Dave, from your perspective, what are some of the other major initiatives that you are going to be working towards in the very short term and bringing other people in the discussion?
So I think, as Dave says, one of the quickest wins would be to have national engagement at a senior level within the NHS and associated structures. Monty can talk to his experience with the Enhanced Recovery Partnership Programme, but it may well be that sort of initiative, where actually a very modest amount of money invested in some leadership and some effective communication transformed practice over a year or so. As they say, you can see it from space. The figures change, the length of stays change, the readmission rates change. And I think that kind of ambition is what we should be looking for. And I suspect that now is the time to be asking those questions and pressing those buttons. But, the restoration of surgery in the context of an ongoing threat from the pandemic is making people think thoughts they maybe didn't think before. And extraordinary changes we saw over very short timeframes, I think, are highlighting the fact that we don't always have to carry on doing things the way we used to. So it feels like a very positive time for those changes to be catalysed, and hopefully CPOC will help to do that. So
just as we're closing here, Mike, remind ourselves that the stimulus for that was the global financial crisis. So it was in 2008, 2009 when the collapse in the economies around much of the world, there were some protected parts of the world, but, and a slashing of our GDP resulted in us being told in the NHS behind closed doors that we'd see a budgetary freeze in reality in healthcare expenditure, i.e. behind inflation forever. And that's a promise that the government has kept. They have cut, despite the rhetoric, they have cut the investment in healthcare in real terms year on year since 2010. That's what they promised. It's what they did. So the response to that was therefore saying, well, we don't have a lot of choice now. We can either fire a lot of people, we can take big pay cuts, or we can start to look at where we can improve efficiency. So hurrah to that. It changed very, very quickly. Now, it lapsed back a little bit as well, but it changed very quickly. So, Desiree, I think we're going to have to say goodbye from the Pocapalooza perspective.
Oh.
CPOC-apalooza.
CPOC-apalooza perspective.
CPOC-apalooza.
CPOC-apalooza, do Pocapalooza perspective.
That's right. Hashtag Pocapalooza.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.